Another thing, about a year before I started on the patch.
I'm not getting up as much at night either.
Yeah.
Yeah, because he's not waking you up.
Part of it. I slept 7 hours straight the other night. I mean, I don't know when I've done that.
Yeah. So after I was on the patch for about just 2 weeks, my current high blood pressure medication ran out. I thought, well, I've heard this thing helps your blood pressure. I think I'm going to just stop taking the high blood pressure medication and see what happens.
Because you had a doctor's appointment later that week, didn't you?
No.
Oh, okay.
So about 3 or 4 weeks later, I went to the doctor, checked my blood pressure. My blood pressure was 120/60. Hell, you can't get any better than that.
You know blood pressure numbers?
Oh, yeah.
Okay.
Yeah. So I didn't ask my doctor. I told my doctor, I'm not taking that blood pressure medication anymore. I don't want to get any lower blood pressure than that. So ever since, it's been in a normal range. I noticed that my varicose veins were not as pronounced as they were. That's probably because of reduction in blood pressure, better blood circulation, so the varicose veins are not showing up as much as they were. Another thing, for about 4 or 5 years, I guess, since I had my knee replacement, they've had me on, had an AFib. They said for sure I had an AFib when I first got out of bed with that. The pain was excruciating on that knee. And so they've had me on diltiazem and Eliquis for blood thinner for about 4 or 5 years. So I thought, well, I wonder what will happen if I stop taking that for a while too. So I decided to stop taking that and totally off of all medication. And about a week after I stopped that blood thinner, I was doing exercise. I always knew I should be walking, but I didn't really have the energy to walk. So with the patch, I had the energy to walk. So I was went out. One time I hadn't walked all day, went out at 9 o'clock at night when it was pretty dark. And the sidewalk was blocked off, had to go into the street. Had to go into the street, and I couldn't see too well there. And I was swinging I had
Weights?
hand weights as well, and I was swinging my arms with that, so I was off balance. And I tripped on a raised section of the street and fell and hit my head there. And you don't have the bloody one there, do you?
I got it.
You got
Did you see the bloody one?
You showing him the bloody one?
Yeah. Did you see this one?
Yeah.
Oh, I seen it whenever it happened.
Oh,
He
okay.
thought it was too graphic to show to the public.
Yeah.
So anyway, rapid healing, it was totally healed. I didn't have it stitched. I went to the urgent care the next morning, and they just put little strips on there, and it was totally healed within 2 weeks. That's pretty darn rapid healing, especially for a guy that's 84 years old. So we did that. Also, I've had a neck when I could barely move it. It was causing me trouble when I get to a stop sign to see if a car was coming either direction. So my doctor finally sent me to a specialist. He said, turn to the left, and I went like that. Turn to the right, and I went like that. He said, you've got what we call in the medical profession a crappy neck. I said, oh, I didn't know the medical term. I knew it wasn't good, but I didn't know what the medical term was. So anyway, it wasn't much he could do about it. But anyway, after being on the patch now for 9 months, I can go like that, and it's not. It was if I tried to turn anymore before, it was a 10 on pain. I just couldn't do it. But now I'd say the pain level is a 1 or less. It's not really pain. It's just I can't turn any more than that. That's all.
It's not terrific, but it's a lot better than it was.
Better than it was. That's a big improvement. I don't have to worry about pulled out in front of a car anymore, which is kind of important. Also, my skin has improved. I was getting callus spots on my skin periodically. I stopped getting those, and the ones I had have gone away.
You know those little dry spots? I don't know if you get any yet.
I
But
go to
they're
a
like-
dermatologist once a year
Yeah,
because of my
Mine were on
dad.
my arms.
The red, dad was a redhead, so.
yeah,
Yeah,
so they
they
checked that
just
over.
aren't there anymore.
The skin is getting better. Also, when I went to my cancer doctor just about a month ago, the first thing he said to me is, "Your hair is getting thicker." And sure enough, it is getting thicker compared to the picture just about
Compared to them pictures.
4 months ago. You can tell it's a lot thicker than what it was 4 months ago.
Well, he's always had good hair anyway.
Yeah,
Well, it is longer, but it's thicker.
It's
He was
thicker.
getting a bald spot.
yeah, his
You
bald
know,
spot
and it's,
back here is not visible at all anymore, right?
I'd have to look.
Look at his,
Oh, you were talking about your hairdresser.
Not really, no.
yeah. And also, I went to my dentist. I had a toothache. Went to my dentist. He said, "You've got this was about 2 to 3 months ago, I guess." He said, "You've got an abscess tooth, and you're going to have a root canal. Have that fixed." But I didn't have much dental coverage at all, other than for routine care.
Maintenance, dental.
Oh, yeah.
Maintenance once a year.
Yeah.
That's all I had, so I decided I'm gonna wait. I'll get a different Medicare plan as of January 1st. So I'll just put that doctor visit off until January 1st.
Which
Well,
you did.
Huh?
And yes, we
Yeah.
waited till now.
So about the first part of December, it really started hurting. And one night just got so bad that I could not sleep. So I took an Advil in the middle of the night, tried to get to sleep. And I took one more the next morning. And I thought, well, I'll just take Advils until next year and get back.
That'll
back in
ruin
there.
your liver by then.
I mean, I can take up to six a day, they said, so I'll see how the pain level is. So after that second one that I took in the morning, I thought I'd wait and see till it starts to feel pain again, then take another one. Well, that's been over a month ago. I'm still waiting to feel any pain. Now I can't say that the patch, I don't know what happened. I'm sure the Advil didn't take the abscess away and totally fix it. So the patch had to have something to do with that. And then the one that's, I don't see how the patch alone could have done it, but I think it's a combination of the patch and prayer. I had, I guess it's been about 2 or 3 years ago, they figured I had trouble swallowing. They finally figured out I had bone spurs growing in my throat and made it pretty difficult to swallow. It was so noticeable every time we went out to dinner or somebody was over here for dinner. Jim always wanted me to explain to people that I'm not coughing because I'm contagious or anything like that. It's just food gets stuck in my throat and I gotta cough it up and chew a little bit more and try to slide it
Well,
down.
and your dad had that, didn't he?
He had
No,
bone-
he had bones.
he
He had
had
bone spurs.
bone in his
Okay.
heel.
Okay.
He had bone
He had-
spurs in his
That's
heel.
right.
So anyway, that
He doesn't do that anymore. You know, in fact, you just noticed that. I called you on it, and you go, "Oh, I don't think it's changed." But when's the last time you were
Well, and
coughing?
the kids mentioned it at Thanksgiving time.
Yeah,
All the kids noticed it that I wasn't coughing anymore. I kind of brushed it off at first, but I don't know. It's not happening. I'm not coughing at all anymore.
what's
So I don't know if the bone spurs are there or what happened. I don't think the patch could have melted the bone spurs, but something happened to clear up the problem, which is the main thing. So I think the main thing is I think we have in the United States not a health care program. We have a disease symptom program. And I think all of our stuff is formulated to treat the symptoms of disease. Nothing that we have is to make you well. I think what the patch does is it works on making the whole body well. Since it stimulates the stem cells will do whatever needs help the most first. And it takes about 1 month of being on the patch for every 10 years you are in age to get up to where it's maximum capacity, probably close to it. So 9 months now is when no more bone spur problem.
Well, I'd like to give a little disclaimer here for those of you watching this video.
LifeWave does not claim to treat, cure any disease or anything like that. We do recommend you consult with your physician before coming off any medication. But these are real life stories from Marty. So, Marty, thank you.
Welcome.